Hammer here, registered physiotherapist. Today I'd like to talk to you a bit about something really common with individuals who have disc herniations, and it's referred to as a list. And essentially what will happen is a lot of times when somebody has a disc herniation, there might be something traumatic which has occurred. So for example, perhaps a lift and a twist in which there's an immediate sort of pain, usually into the buttock down the leg, which causes numbness, a shooting pain, sometimes some cramping, tingling, etc. And what will happen in a lot of cases is when the patient comes in, they'll be listed to the side. And what I mean by that is they'll sort of be in almost this lateral shift, so to speak. And again, what that's a result of is essentially the body trying to protect itself from putting pressure on a nerve root. So it'll tend to, a lot of times, move away from where there's pressure on a nerve, which is causing this pain. And so again, the patient will come in this position here. And what we want to do essentially is when the patient comes in, the first thing we have to do is actually correct that list. Now, what's really important in terms of list correction is to make sure that we don't cause more symptoms down the leg. So what I mean by that is, so if somebody, for example, if they have shooting pain that might be going to the hamstring and we try to correct the list, well, if that pain goes further down the leg, so if it peripheralizes more, that's considered a red flag and we wouldn't want to do any more correcting, so to speak. We'd stop immediately. Now, on the other hand, if the pain centralizes, and what I mean by that is if the pain starts to actually move up the leg into the buttock and then ideally into the portion where the source of the pain is, which is in the middle of the back, this is referred to as, again, a centralization. That's a green flag. That means we continue on. We want to correct manually, so to speak. So one list correction technique that you can do essentially is, so if your arm, let's say, is listed off to the side here, so to the left side, what you can actually do is you can go up against the wall and you take your hand in through the hip region, and essentially what you're going to do is you're going to move the hip and repeat towards the wall, right? So I'm putting pressure on, pressure off. Again, I'm just putting more, I'm just repeating this sort of list correction, so to speak, okay? And again, what you should find is as you're correcting here, the symptoms, the pain, it moves from the leg area into the center of the back. And again, I have to emphasize, if the symptoms move further down the leg, if they're peripheralizing, you want to stop immediately. You're actually going to cause more damage in that case. So again, with this particular exercise, you want to make sure that you're doing it, first of all, in the correct direction, and that your symptoms centralize, and your leg symptoms, again, should get better, even if the back pain gets a little bit worse. So again, just make sure that this is an appropriate exercise by speaking with a physiotherapist or a doctor. Thanks again for watching. Have a great day. Take care.